And so we began our pilot studies. And I'll tell you the first case because it's a very interesting one. In 1952, I had just received my first supplies of niacin and vitamin C. And I was then working in Regina, Saskatchewan, which is north of where Dr. Osmond was working in the mental hospital. So I took a supply of these two vitamins to Dr. Osmond. And while I was talking to him in his office, the chief psychiatrist for the hospital came in and told us that Kenneth, the young man called Kenneth, was dying. Kenneth was a catatonic schizophrenic. He, in fact, was dying. And he said, we have to notify the family so they get here in time. So I said to Humphrey Osmond, well, if he's dying already, we've got nothing to lose. Let's go down and give him some vitamins. So we went rushing down to the ward, and there was Kenneth lying on his bed, mouth open, breathing heavily, completely unconscious, totally out of it. He was, in fact, dying. He couldn't swallow anything, so we put a tube into his mouth, and we poured in a huge amount of niacin and a huge amount of vitamin C. I think we put in 10 grams of niacin and about 5 grams of vitamin C. Now, the first question was, would he survive? Were we going to kill him? Because this was the largest single dose that had ever been recorded. Now, we knew from our reasoning that we had to give a large dose. He didn't die. So the first step, he didn't die. The second day, he sat up and drank it. 30 days later, Kenneth was normal. His family came in and they said to Dr. Osmond, why are you keeping Kenneth here? And Dr. Osmond said, we're not sure how long he's going to stay well. They said, we don't care about that. We want him home. They took him home. Now, that was the first case we treated in Saskatchewan. And it's always good to have the first case positive because it gives you added incentive to continue with our studies. I did a recheck on Kenneth 15 years later. I wanted to trace him back to see what had happened to him. And by that time, I was in charge of a large research division in Saskatchewan. So we did a follow-up on him, and we found Kenneth. He came in to see me. He was he was a businessman. He was president of the Board of Trade. He couldn't remember ever having been in Weyburn, but he was still normal. Now, that was very exciting. So that was our first study.